Hi, and welcome to Nursing 660 FNP Advanced Practice through the Lifespan, Primary Care of the Adult Client. My name is Jessica Stone-Lanfranchi. I'll be co-teaching this class with Professor Kavanaugh. She will be running the clinical portion of this course. My email is jstone-lanfranchi@goodwin.edu. I'm so excited to be on this journey with you guys as you prepare for your APRN role. I'm both honored and excited. I went through the same thing that you're going through. I took a hybrid graduate course in my university, and it was wonderful. And it was a lot of work. It's a tremendous amount of work, but I'm confident that you guys are going to do great. And I'm super excited to help guide you through this process. Graduate school is not easy, and the amount of content that you are expected to learn, retain, and apply is tremendous. And my goal is really to try to present it to you in a way that helps summarize and direct and motivate you to want to learn. Much of your knowledge and understanding throughout this course is going to come from your own reading and self-learning. But my role as your professor is definitely to help keep you focused and guided, as well as assist you in preparation for your boards. And utilize and apply the knowledge that you're learning through this course and take it and help you apply it to your clinical practice as you go through clinicals. I did have this same class with the same textbook while I was in grad school, and I have to tell you, this was probably my favorite textbook of all the textbooks I had to learn from. So I'm excited to be teaching it to you with this text. It's very thorough, it's very holistic geared, it's not over the top in terms of details. It really gives you a good focus on the basics of what you need to know in terms of primary care. I will give you the heads up that this particular course in your studies is really the foundational meat and potatoes that will really help guide you when it comes time to sit for your boards. So I would really encourage you, as you go through this course and you go and read your textbook, you really take good care to take good notes and outlines of the chapters, because this will help you study when you do have to sit for your boards. I found myself using this particular class and textbook as a great reference tool when I did sit and study for my boards. I found it great to go back to just to refresh my memory when it came to applying a lot of these questions with the data that you're learning to your actual boards questions. I found it really helpful. So just keep that in mind. You want to keep your notes and your outlines very organized by body system, as the book is set up that way, particular with each chapter. So do yourself a favor and keep really good organized notes. And also, just as a side note, these are the textbooks that you are required for this course. Keep in mind, these textbooks are actually phenomenal reference books that you will always refer back to at some point, likely throughout your clinical practice. So don't think that you're spending all this money just for this course. These will be really helpful in the future, especially your nursing procedure textbook, which gives you step-by-step directions in different particular procedures like suture removals, basic procedures that you will do at some point in your career, in your practice. The primary readings that you will find on your syllabus are from your primary care textbook. Again, this is an excellent textbook. Utilize it to your advantage, please. Keep in mind, your textbook goes through a lot of different things to help guide you in learning these particular, the particular subject matter in each chapter. The textbook, if you look at it in the beginning of the textbook, before you even get into the chapters, it'll talk about the different techniques that the text uses to help guide you. In each chapter, they talk about differential diagnoses, which will come up over and over again. That's something as a nurse practitioner that you will familiarize yourself with in terms of, being presented with symptoms from your patients and having to determine, what exactly the diagnosis is. And we always come up with differential diagnoses as we are plotting out our patient's care plan, just to make sure that we're covering all our bases and we're not missing anything. So the book goes into differential diagnosis within each chapter. It definitely goes into drugs commonly prescribed based on the body system it's talking about. So definitely take note of that when you're reading your chapters. It always has side notes about the patient's voice when it comes to the different diseases it's getting into and how the patient experiences that particular disease. It also goes into diagnostic reasoning algorithms, which are phenomenal because they really give you a good outline as to how the diagnoses came to fruition based on the symptoms the patient is presenting with. Again, something else similar that the chapters do go into are what they call treatment flow charts, which again are just step-by-step protocols that the book lays out for you to kind of show you how they came up with the treatment plan based on the disease process. And finally, another great thing the textbook offers, which you will also be creating yourselves and doing within your discussion boards, are case studies to help guide you in safe practice and application of your knowledge to a particular patient study. Okay, so in this particular class, the outcomes, which are clearly listed in your syllabus, are for you to integrate concepts of health promotion, disease prevention, wellness, and primary preventative care in the adult population. We want to incorporate family theories into the role of advanced practice, the practice nurse, which we will get into within this particular module. We want to apply principles of assessment, diagnosis, planning, treatment, and evaluation of common acute and chronic illnesses in the adult client. We want to learn how to prescribe and evaluate evidence-based pharmacological and non-pharmacological treatment modalities. We want to demonstrate effective communication, collaboration, and the role of the APRN as a vital member of the interdisciplinary healthcare team. As you go through this particular class and you learn how like the art of what it is to be a nurse practitioner, you're also going to kind of figure out what role you will like to best fit in your own practice. So keep that in mind, when you're learning each chapter and each body system, what you're most drawn to in terms of, what you find most interesting or what you feel the most passionate about, because this can guide you as to where you want to practice when you do become APRN. We're also going to have you exploring regulatory principles and scope of practice when providing care to the adult client as a family NP. Of course, one of your outcomes also is to uphold standards of care while performing competent, safe, ethical, legal, advanced practice nursing as an FNP student in the clinical setting. So whether you're a student or you're practicing in your practice after you've graduated and have your license, you always want to be very conscientious about your scope of practice, and not just what your scope of practice entails, but what your knowledge base allows you to safely practice. Don't ever be afraid to ask questions or know what your limits are, because if you never want to be performing unsafe practices just because you're in the heat of the moment. Next, definitely look through your course syllabus. Plot your course syllabus out within your day planner or however you want to organize yourself on your phone, but really use this to guide you and keep on track with your assignments. These on the left-hand side of your course syllabus, this is just for this particular week. Obviously, classes begin. Our classes start Monday and they end Sunday evening, okay? Your discussion boards are due by Wednesday of the week, by midnight of the Wednesday, and you have to reply to your classmate by Sunday at midnight, okay? So just keep that in mind. Your first response to your discussion board is due Wednesday by midnight, and the response to your classmates posting is due by Sunday at midnight, all right? Your quiz is due by Sunday. Professor Alana will go more into the clinical piece of the TIFIN hours, case logs, and the weekly reflective journals, which will also be due weekly by Sunday at midnight, okay? Keep on top of your work, guys. This is a lot of work. We understand, everybody's busy, but the due dates are clearly written. Please just try to keep on top of your assignments, because it does get overwhelming and you don't want to wait till the last minute, especially when it comes to TIFIN and your case logs. Try to get those done by the end of your clinical day, because it's a lot to remember and have to input. Okay, Dunphy is the primary care book. That's the primary book we'll be reading this week in particular. You should have had chapter 3, and it's all about health promotion. Okay, that's what our focus is in this particular week: health promotion, family theories, harm reduction, disease prevention, and immunizations. In your Cash and Glass book, if you haven't gotten it yet, don't worry. You can always go on Amazon and look up this particular book. Chapter 1 is available to read actually online through Amazon. So if you wanted to just, if you haven't gotten the book yet and you needed to read that chapter or want to familiarize yourself with adult preventative healthcare, which is basically in that chapter 1 of that book is based around immunizations for travel and medications. That's what that is. Okay, so definitely use your core syllabus to guide you. It has all your due dates, the percentages of what your each grade is worth in terms of assignments, and just the basic expectations, which I'm sure you guys can familiarize yourself. And just if you have any questions, you know where to find me. My email is listed at the top of the syllabus. Okay, so we already talked about the introduction and just how to use your textbook and the different things that the textbook offers within each chapter that are really helpful in applying your knowledge and applying it to your clinical practice. So again, these are those things that I really want you to definitely utilize that your textbook offers you: differential diagnoses, the drugs commonly prescribed, patient's voice, et cetera, et cetera. Next, we're going to cover in this particular module is about family theories. And basically, we're just going to talk about the concepts of family-centered care. Obviously, in any of your care, whether you're an RN or an NP, you want to try to get the family involved, because if you have the family involved in the care plan, usually that will help things facilitate and make it easier for the patient. In terms of family, you also want to understand what a family is and respect for all versions of what constitute your particular patient's family and support system. Okay. As we know, as times are going on and things are changing, families are changing, so we have a lot to take and keep in mind and be sensitive to when it comes to talking to families and understanding what the family system is for your particular patient. You want to also make sure we're developing quality relationships with the patient, family, and the healthcare providers to ensure quality care. Next, we're going to be going over harm reduction. Things we're going to be looking at in harm reduction that you need to focus on are influences to be knowledgeable about that could cause harm, ways and factors to reduce harm, and the responsibilities and duty of the NP in reducing harm. We'll get into all of those things. Health promotion. Okay, we want to define health. What is health? What is health, right? The World Health Organization has its own definition of it, as well as the adults, the Holistic Nurse Practitioner Organization also developed a beautiful definition of health, which we'll get into. We're going to talk about the role of the NP in health, 3 levels of prevention, and the screening processes. Next, we're going to get into disease prevention. We want to talk about risk factors, modifiable versus non-modifiable. We're going to talk about influences on health promotion, health literacy, tests to assess a patient's level of health literacy. These are really important things to learn and understand, because if your patient really doesn't grasp basic common knowledge, health sort of things, you really have to kind of change your way of speaking to them about how they can improve their health or what changes need to be made. You really want to get to their level of understanding, so it's not like you're talking down to them or above them so that they don't even understand or get frustrated and don't even want to understand. This is the importance of really grasping and trying to figure out where your patient falls on the literacy level, both in health and just education in general. And then we're going to definitely get into the government initiatives. These are really important initiatives and governmental bodies, entities that you need to know about and familiarize yourself with, because these are the particular governmental agencies that actually are put into place the initiatives that guide our evidence-based practice screening tools. So for instance, our guidelines for our immunizations are all based around government entities. And you can find a lot of the government initiatives and the entities that, came up with these in terms of like the Healthy People 2020. All of those things are found on the CDC website, Center for Disease Control. So familiarize yourself with that, because on the boards, there are definitely questions in regards to what the CDC guidelines are, whether it's about immunizations or appropriate screening tools and the appropriate times when you're supposed to screen the patient based on their age. Next, we're going to talk about individual influences. in terms of the patient's readiness to learn, the health belief model and where your patient falls on that model, which is important to know so you know how to guide your practice and your plan of care for that particular patient. You want to look at community influences within your community or where your patient lives, and of course, legislative influences like we just spoke about. So those are the things I just wanted to outline basically where my lecture is going to be focused around. Now I'm going to get into the lecture. So we're going to start with the family-centered care theory. So just let me